During COVID, there were lots of questions around hesitancy. And what does hesitancy mean? Why are particular groups in general hesitant? I think that I thought, and maybe other healthcare practitioners thought, that the answer was clear about why people are hesitant. But I saw that it really wasn't. And there were a lot of conversations that we were having in the community that really weren't expressed. And we really wanted the people to have an opportunity to tell their stories by themselves, unfiltered, no scripts, what they experienced and why they came to the decisions that they came to. And that's why we did this documentary.
When the pandemic hit, it was very frightening.
In the United States in particular, most individuals are highly skeptical.
In my neighborhood, my community, the people that look like me and talk like me, and they don't trust a lot of that.
It was our community members that were dying. It was our community members that were skeptical.
As I reflect on the initial, start of the pandemic, was the amount of fear and uncertainty that seemed to pervade many communities, not just communities that have been historically marginalized and underrepresented, but among all Americans and people around the globe who are grappling with this disease that seemed to come out of nowhere and really sort of take over our everyday lives. It changed everything about the way we interacted, about the way we were able to go to work and engage in work. And so I remember the fear, and I remember the palpable uncertainty and the questions everyone had about how long is this going to last? How is it going to affect me? Will we find a cure? Which I think was most on everyone's mind.
Well, when the pandemic hit, it was very frightening because people were dying and the authorities didn't really have a clear answer. It almost felt like they were making shit up as they went along to try to create or to prevent, a public outcry.
It was a serious time. I mean, we were facing, pressure. We were responsible for people's lives. It's two sides to it, right? Being a leader, I think, in part, that all of us thrived in that situation because that's why we're here. But there's another very human side to it, that we, are scared, and the decisions that we're making, are they the right decisions for the populations that we're serving?
It was awful because I was there just coughing away, coughing. You're sweating, you're sick, and I have underlying issues. So when I called the EMS, and when they came right away to Hartford Hospital, they took me right away to Hartford Hospital, and I spent a week there.
It was a frightening situation, I would say, that in India where you saw chaos, and until, our process of coming to the US was done and we had to travel. So I was in a dilemma whether I should come to the US or stay back with the family there. So that was a big decision that we as a family took, that we want to come to the US, and we did. It was scary for everybody, and I saw in the news and family members that was dying because COVID.
When we got the first call was really about, it wasn't a Hartford resident, it was someone that didn't live in the city of Hartford but was in our city, in a hospital in the city, and so that was sort of like the first case, quote unquote, in the city. I'm Leanne Arroyo. I'm currently the Chief Operating Officer at Charter Oak Health Center in Hartford, Connecticut. Previously, I served as a Director of Health and Human Services for the City of Hartford from 2017 through 2023, and I led the public health response to the COVID-19 pandemic. So I told our state contact that had reached out to me, I'm driving, I'm in the middle of the Merritt Parkway, I'm about to head to my cousin's house to pick something up, just give me 15 minutes. And so I stopped at my cousin's house and I walk in and I'm like, no one touched me, no one touched my daughter, no one touched my mom. Just please, air kisses, I need space by myself, quiet, because I have to have this private conversation. And I got the information, and it was, frightening, of course, right? And so it was really setting off a whole flurry of phone calls. So I'm driving back late on a Saturday night from Bridgeport back up to Hartford, letting the mayor know, having conversations, and so letting everyone that needed to know that evening what was happening so that we can plan for the next morning, which was a Sunday. I have family members calling me from different parts of the state. What's going on? What's going to happen? I hear grocery stores are going to close. I hear this is going to close. I hear that's going to close. And you're like, I'm having these conversations, and I can't really even give them a warning about this because we have to have everything in place, and I can't get ahead of my mayor. We can't get ahead of the state. Being very clear that this is the best information we have now, and it may change, and that's what science does. Science learns, adapts that information, incorporates that information into its existing body of knowledge, and then it creates better information. And so really always carrying that message. So whenever I was with the mayor and I served as an interpreter for him, it was always with that point in mind of letting our community know this is the best information we have now. It may change, and we have to be okay with that because that's sort of the situation we find ourselves in.
When you're talking about messaging, we are the middlemen. So we are delivering messages that partially we know to be true. And then there is a level of, is there some unknown, right? And that unknown is the untold message that we had to deliver to the people. And I don't think that is really talked about enough.
We were getting information from the federal level and from the state level saying, go isolate yourself in a room, use a separate bathroom, use this. And I immediately was like, that's not what our community can do. We don't live in a single family home on an acre with a basement and 3 bathrooms, right? We live in an apartment that may be 2 families sharing it.
I think what people needed to hear was something else, something that wasn't said to address other underlying issues that we have in our society. And so that's what we're here to talk about.
I feel like CDC and other governmental-based organizations for the vaccine could have done a better job as far as with giving out information. Sometimes, if you weren't at the table, you would miss out on a whole lot. It's like if you're not at the table, you miss out on the meal. And you expect certain people to be responsible for giving out information, and they did not do so. It was pretty much whatever leads their sphere of influence that governs their ideologies. And that was a major problem with the vaccine, with COVID-19, when it comes down to the pandemic.
You know, I don't want to really go into politics that much, but I think that the government, certainly the Trump administration, are responsible for a lot of unnecessary deaths. Their response to this disease, this infectious disease, was just miserable. And I have a lot of respect for Deborah Birx and Anthony Fauci for trying to deal with the craziness that was going on. And yeah, that was like a low point. And as far as for people having trust in the government, oh my gosh.
For me, I don't think, like, when it comes to issues of health, I think the only the only part that the politicians need to play is is introducing, the medical people so they can talk about what they got to talk about, and then making sure that whatever these people say has to be done, that they use their power and their influence to make sure that that's happening. You know what I'm saying? So yes, I think the government plays a big role, but is the role that they choose to play that matters. And right now, I don't think they play a very smart role.
In my neighborhood, my community, the people that look like me and talk like me, and they don't trust a lot of that. Tuskegee experiment, that's one, we always have a problem with it, so I'm one too, I don't believe in it that fast. If you're in the inner city, you get the last information, you get last on the totem pole as far as medical. Most of them don't have medical, and if they do, it's a poor medical system, so you get the last.
So I'm Dr. Wisdom Powell. I'm the Chief Purpose Officer at Headspace. I'm passionate about population health. I'm a trained trauma psychologist and a policy thought leader, and all of those roles are what I'm bringing to bear to this conversation. When the pandemic ushered into our world, I was living in downtown Hartford. And what I remember in that moment, in the immediate surrounding community, again, were people who were trying to figure out what this would mean. And at that time, I was also being called as a leader for UConn's Health Disparities Institute to speak up and out about the challenges and to help the city and the state sort of think about what our response strategy was going to be. So at that time, I was working alongside Mayor Bronin and others to head the COVID-19 Recovery and Response Committee around population health and how we were going to respond. These are not, easy issues to think about. I mean, we're talking about historical, inequities. We're talking about hefty issues like racism, both structural and interpersonal. And we still don't have the right language and tools and really competency, quite frankly, structural competency to grapple with those issues. So when we ask ourselves, did systems set people up for success, I think we have to own that this period wasn't revealing something new about, systems and ineptness. It was really just showing us the fault lines that lie in our systems. And I think for that reason, it was really hard for leaders to set communities up for success. We made a lot of missteps, but we were also grappling with a new enemy. So what I saw in this period of systems translating information to communities is that we failed to invite communities into the conversation in a way that would be more participatory. And when you don't do that, you're often doing things about community without them. And people felt that. People also remembered the past. And those things made it more difficult for communities and systems and leaders to come together to mount a collective response, recovery and response strategy.
When you practice in an underserved neighborhood and treat people that have very few resources, you realize how many barriers there are between them and what I would call their optimal health status. The best health that they might be able to achieve if everything was going in the right direction and if they had all the resources they needed. When you have somebody with all those barriers, you have to recognize them and realize that just telling somebody that they're at risk for a disease does not necessarily mean, that they're going to understand what that means to them in real terms. So part of your job as certainly a clinician or a public health official is to try and communicate with each individual, knowing that they are an individual and unique, and to understand and hear from them what the barriers are between them and doing whatever it might be that we believe is in their best interest. They have to decide what they feel is in their best interest. And once you understand some of those barriers, to work with them so that they can figure out how to overcome those barriers. My name is Bruce Gould. I am a general internist primary care physician. For 27 years, I ran the clinics upstairs, the Bergdorf Health Center clinics for UConn and St. Francis Trinity. And so the surrounding community around this facility, that was actually my neighborhood. And I did house calls in those homes, and those were my patients came from, but they also came from the South End and beyond. And then in 2008, I became the pro bono medical director for the Hartford Department of Health and Human Services. So I think when the pandemic began, and first of all, we had no vaccines. We first looked at testing and how do we test? And we actually went on Saturdays to the baseball stadium and started doing, education and testing, and you guys went out to various neighborhoods to do testing. As we developed those vaccines and now wanted to get them into our citizens in the neighborhoods, we found we had lots of hours here, but a lot of folks could not get here or could not take time off from work. They're hourly employees, or realized after some time that probably the next day after you get the shot, you're not going to feel well. And that means you're going to have to take off from work. If you have to take off from work, you don't get paid. And so talking to people and trying to coordinate it with their lives so that under best circumstances, where they don't think that the vaccine is going to kill them in some way or be unhealthy for them, but are willing to take it. There are a million reasons and barriers between them wanting it and actually getting it.
We knew, and we had had conversations, and I had said many, many times, the phone, unless we have bilingual workers, is not gonna work. The internet is not gonna work. We really needed to have a different system. And so, and I'll say this, if you could have created the most inequitable system imaginable, that was what was created, not just in Connecticut, but across the country. You had to be able to speak English to make a phone call. You had to be able to have access to a computer and internet to be able to make an appointment. You had to speak English in order to make that appointment. You had to have a vehicle in order to get to that vaccine appointment. And I think we, to our credit, recognized that that was not going to be something that could be done by especially our senior or elderly individuals. I think we also quickly, because we were able to, we got funding very quickly from the CDC Foundation. We had, just like we did for testing, that we had free transportation to testing, we had free transportation for vaccine. We rented a bus to bring people to vaccine sites. So I think we worked as much as we worked within the rules that we had, because we had to, right? If not, we would lose the vaccines. But at the same time, where there weren't necessarily guidelines, we kind of used that to our advantage in terms of being able to be nimble and flexible and quick in getting stuff out. And so I think that was great to our credit. And we also recognize, in those first 2 weeks that we had to use the online system, we had to do everything, and we did that, right? Outside of this initial clinic, we did those things, and our clinic is located in the North End of Hartford, which is a heavily African-American Black neighborhood. And to walk into my lobby and not see people that represented us was not acceptable to me. And I think you all know what was my reaction. Call everyone and cancel every single appointment that's not someone from a Hartford resident. I definitely was not happy with what I was seeing, because it was our community members that were dying. It was our community members that were suffering. It just really struck me that day that we needed to do it differently. That what we were being told to do did not match the reality of what we needed to do and the reality and gravity of the situation that we were being faced with. And I was very grateful and appreciative and felt very lucky to have the support of our mayor in saying that we were only going to vaccinate Hartford residents, that was going to be our priority. and that we were going to do it no matter what. And so he immediately was able to tell me, how many people do you need to hire? How do we have to do this? And we were very quickly, within 24 to 48 hours, able to set up a hotline for people to call. We were able to set up a completely offline system for people to do this work. We were able to have people knock on doors to do appointments for residents and set them up with vehicles. And so I think that was, for me, the turning point of saying, like, there are rules and we have to follow the spirit of those rules, but we also have to be flexible because we have to do what's right for our community.
My name is Faith Palmer, and I currently work for the City of Hartford's Department of Health and Human Services, and my role actually started here when the pandemic started. My primary role during the pandemic was that of providing support and operations when it came to COVID vaccination clinics, COVID vaccination testing sites. I worked a lot with our director at that time, Liani Arroyo, and worked alongside the school system, worked with federally qualified health centers to put together these different clinics that we had for vaccination and for testing. We had, I would say, every week at least 7 to 10 clinics for either vaccinations and or testing. So that was a large feat, and there was a great team that I worked alongside to get that done. We also had staff members and team members within the Department of Health and Human Services who were from the community, and they were community health workers, and we also had canvassers. And we literally went door to door. And it wasn't by random, it wasn't happenstance that we selected areas, but we actually took the epidemiological route and we studied. We have data that we were able to go through the numbers and create mapping of where we saw that there was low numbers in vaccinations. So we mapped everything out and we went door to door with our medical volunteers, and we vaccinated individuals. Some people still weren't willing to be vaccinated, and for us, that was okay. That was 100% okay because we were able to give them information or to hear from them on what their hesitancy was.
My name is Buster Frederick. I'm a community health worker for the city. I started going door to door, first even trying to get people to take the vaccine. In the beginning was a hassle. I mean, they was totally against it. They thought they had chips in it. They thought they had all kinds of things to manipulate, mind manipulating thing. I mean, the conversation we had with people on the street was crazy.
A lot of these places, before we show up, the information we're giving to them is completely new. So I really honestly feel that if we hadn't been there, they might not have gotten the message at all. That's really our best weapon, is to educate them as far as the safety of the vaccine, letting them know that these are all been tried and true now, that there's no worries.
I will say that conversations that I had with community members, I never felt that there was a huge sense of mistrust. I felt that there was a huge sense of a lack of information. And so, yes, there were pockets of mistrust. I'm not going to discount that. Like, I think we all know that. We, even in our own department, we were all working there. We were all having conversations about who's going to get vaccinated, who's not going to get vaccinated, why I need you to get vaccinated. And listen, I myself struggled initially with whether I was going to get vaccinated or not, right? I was like, I'm going to wait for this vaccine, or I think I want to wait for this vaccine. And I remember saying that to the mayor. He was like, what? And I was like, well, like, I'm reading information. And I took the opportunity to find information that, to me, I trusted. Like, I tell folks all the time, we have teachers because I can't be a teacher. I'm not an educator. And so I trust the teachers that are educating my daughter. I work with them. That doesn't mean I blindly don't pay attention and let them do what they're doing. I have conversations with them. I get to know them. And I trust that they're going to educate my children. And so I look at it as our researchers and our providers that are in our own community. They're educated. They know this information. They understand this information in ways that I can never understand. And so I think I was trying to get as much information from folks that I was trusting and trying to bring that to community members. And we would do vaccine clinics, and you know that there were people that would be coming in, have a lot of questions, and I think we had a pretty good track record that before they left, at least half of them were getting that vaccine, or if they didn't get the vaccine, felt better about having information about the vaccine. When we did door to door, we had folks that got it and called other people. Why? Because we showed up at their door with maybe not always a provider that looked like them, but other people that look like them that can say, I got the vaccine, and I got the vaccine for these reasons. And so I think, again, the mistrust is always going to be there, right? There are structural issues that have created that mistrust, and all we could do and all I could do was do my best to give people information and allow them to make their own choices.
My own personal journey from hesitancy to advocacy was really grounded in the fact that I live with a autoimmune condition. I've been living with systemic lupus erythematosus since I was 10 years old. And so the stakes for me, like getting this right, were quite high. So the hesitancy for me was around, is this vaccine going to produce, some other, fallout with respect to my symptomatology or my prognosis as a lupus patient? And again, the evidence was mixed. My own rheumatologist was like, we don't know how this is going to interact with other agents that you're taking, chemotherapy in particular. So it was that, sort of real, life, dilemma that I was facing that caused me to hesitate. And, I'm a Black woman living in America and have had my own experiences with systems that, create, medical malice, either intentionally or unintentionally. So those things, the history of my experience, my lived experience, and my health conditions kind of collided in a way that meant that I needed to do my homework. And I'm a scientist and an egghead, so I wanted to read the studies. I wanted to evaluate the data. I wanted to have conversations with my providers to come to that decision. And once I fully understood the benefits for me and other persons like myself who are higher risk, it became clear to me that I needed to get it, one, so I could be here for my family. I did not want this disease to steal me away, right? I needed to do something to ensure that I felt like I had a chance, a fighting chance during this global pandemic. And that was kind of the fire in my belly for advocacy. But I also realized that after I, read the science and all of the information, that it would not only protect me, but it would protect other people around me. And so it became a lot about me wanting not to create a circumstance for another person that would put them in danger. I got really concerned about would I be transmitting this to someone else unknowingly, even after I got vaccinated? So for me, it was all grounded in this collectivism that I feel in my spirit, but also this real desire to make sure that I am here for my family and that they are able to benefit from what I'm doing in the world in ways that are, don't just take into account the now, but the future.
My job required it, and I drug it out till I couldn't anymore, where it was either my job or the vaccine. And obviously I took the vaccine for my job, family, bills, things of that nature. At the time, I didn't own my own business. I didn't want to take the vaccine. I don't believe in the vaccine. Came up too fast for me. I do think that you can stay healthy without taking vaccines because we have things. I believe there's a cure for everything except death and old age, But we have it right here. But I think it's such a big money maker that you're going to push your vaccines. The doctors are going to push it. They're going to push the vaccines over taking healthy items. What happened to the people before us who got sick? They use things. Now all of a sudden everything's a pill or a vaccine. So I take different things. We do CMOS here. We do different things because it works. I don't think the FDA has to approve everything. If you look at Eastern medicine versus Western medicine, it's a big difference. They don't run to all vaccines. They run to nature. And I like that,
So I got my vaccination, I think around 1.5 years back. I have both my vaccinations done of COVID. Primarily for me, it was for protection against whatever was going around the world. And to that, I would say that when everybody is suffering, when everybody is not so well, and you don't know that if the person that you're meeting may be infectious and you could catch the virus from them, it is so damn important that you yourself are vaccinated to avoid any such mishap. So I'm happy that I'm vaccinated, and I'm waiting for my third vaccination now.
So I personally chose not to get vaccinated just because of, number one, the shutdown, which was very hard, just being able to go out anywhere. And then there was a lot of suspicious things with the vaccines. So I just chose altogether just not to get it and just stay in the house.
Well, me, I was vaccinated. The reason I got vaccinated was because I had caught COVID and it was very bad. I have younger siblings, so I chose to keep all of us safe by just getting vaccinated. But it did take me a little while to get it because I was still suspicious due to rumors on the internet. But at the end of the day, I got it because I was if it's not harming people close to me, then it wouldn't harm me. So I chose to get it just for the safety of everyone around me.
Have I been vaccinated? Yes. Now, was I afraid of the vaccination? Of course, because there were a number of stories going around from various doctors who said vaccines were good and vaccines were bad. And obviously, when you hear a lot of different stories, it weighs in on what to do, how to do it, when to do it, where to do it. And I'm going to tell you this, and I'm just going to be forthright with you. I think when it came down to vaccines and vaccination confidence, it really got political. And that's one of the problems. So whomever the leading politician was the one who was leading the charge, whether for or against. And because we are in a tumultuous political season, and we have been for a number of years, it's not just the past few years, but it's been all the way back, I won't even say since been a child. Because of American politics, it's not the conversation about people getting better. It's about who's going to lead in economics, who's going to lead in a number of issues that have to do with political freedom. And that has been a troubling issue for this country.
I couldn't wait to get it in February 2021. I was sick at the time, so I had a chronic kidney disease that was pretty disabling, that forced me to retire from work, and was on a transplant list. And so I did not want to get any sicker than I already was. So I was happy to get a spot at the Dunkin' Donuts Park in February of 21 to get my first shot. And then later in April, though, the after effects of that shot, though, I felt like I got hit by a truck. I mean, it is, it was a tough few days after the vaccination, but, worth it. It was just an indication to me that the vaccine my body was responding to it, and that was a good thing.
I was vaccinated because it was required of my prior employment, which I ended up walking out of anyway. But yes, I was vaccinated twice. I got the vaccine, and then I got the backup. And but I haven't had COVID. I tell people that I haven't had COVID because I smoke cannabis every day. I use it in different forms. Sometimes I make tea with it. I have it in edibles, and it's been great.
A lot of people think that, physicians, healthcare leaders, that it was the easiest decision to be vaccinated. We too have families. We have roots in our communities. We have ideas that, may not align all the time with what our job says is the right thing to do. I think personally, I come from a family that really prioritizes natural healing. And so in the beginning, it was difficult for me to take the vaccine. I think that also as an epidemiologist, I kind of want to, either read more studies about something. And this is even for my children. I like to investigate what's going on. I wanted to know more information before I actually took a medication. And I think also that for the United States particularly, we really don't market vaccinations to adults. Usually it's for children, so it's easier for us to give children vaccines than I think adults, unless they're over a certain age. So I think that was part of the issue, because adults are just not used to being marketed a vaccine. They're usually for kids. That was the other issue for me. I think I just wanted a little bit more information. And I had to seek some counsel. I did. And I realized that it was the best thing for me and my family. And so after doing my own investigation, and regardless of what was, said in the media, and regardless of what I had been given in terms of information, I still had to research that information for myself before I felt comfortable. But we encourage everybody to do that. We give them information, and then you make a decision based on what's good for you and your family. But for me, I did take the vaccine. But again, it's one of those things that is complicated, because even though I took the vaccine in my family, I have family members who didn't. And even with me educating them on the benefits of the vaccine, really one of the things that stood out for me was history. The points that kept coming up in my family was, look what happened, to African American people during the Tuskegee experiment, right? And just lots of things throughout history of how medicine was used inappropriately, with Black and brown communities. Those communities were the ones that were hesitant during the vaccination, especially getting it out there, actual numbers of taking the vaccine. So these are some things that we were addressing in my family. Also, that information was passed down to me. So I also thought about those things as well. And, in the future, what does my future really look like having taken the vaccine, knowing that these things did happen throughout our medical history? And I think that just doing the research on your own may not be enough for some individuals. They really need reassurance. They really need, like I said, more conversations to address the past so that we can move forward in the future. And I think that they need to see change. Like, when you're in a car and there's gas, you're driving it, right? If it's on E, like, you're not really going that far. So you really have to start filling your gas up, your tank up with gas so that you can move. I think people really want to see the needle for our medical care model or healthcare model move in a positive direction. I think the Black and brown community is used to seeing their community fed information, given a lot of medication, and sometimes they feel like the community is sicker or remains sick. So how do we change that? How do we improve information? And how do we address things that happened in the past so that we can have a productive future? I think, that is a recipe for something that would be beneficial and useful moving forward.
In 2024, because the fear of the pandemic is now really gone, I don't hear people talking about the vaccine anymore. Except just like a common flu shot, that you take it at your own risk. And now it's interesting how bound we were just a few years ago, and now how free we are right now. Perhaps we've been free the whole time, and we just never knew it.
I don't think it is as important as it was in 21 because of the infection that could travel. Right now, there might be somebody infected with COVID, but with the passage of days, he overcomes it. So the immunity has gone stronger, and hence I don't feel the need.
Still feel like it's more to it that we won't know until someone wants to release it, because it's just like now when you get sick, like recently a friend went on vacation and she says she was diagnosed with COVID. COVID, if it's the flu, it's COVID. I think everything is COVID now. You don't know what COVID is and what isn't COVID. Everything's COVID when you go to the doctor. So I think people still feel the same about it. A lot of people think it was the government, you never know. I don't trust anything when it comes to vaccines and all these overnight things that come in existence that you didn't have years ago.
Well, I think the message right now in 2024 is that we have to continue to do the work of building relationships with community. And we have to continue to seek opportunities to engage them and treat their lived experience as subject matter expertise. What I learned so much during this period, both of leading the COVID-19 Recovery and Response Subcommittee and also working alongside other leaders, policy thought leaders and others, community leaders, was that we often, when a crisis happens, we're suddenly all in, right? Like we want to hear from you, we want to bring you along. And then at some point we start to, recoil or retract from that. We have a lot of mission drift in this space and around this issue. And I think we have to stay true to the mission, because what we know for sure is that there's a cyclical nature to these kinds of global crises. And whether it's the COVID-19 vaccine or voting, all of these require us to put in the work of building the relationships that will foundationally support us in making decisions that are going to affect the whole population.
I think the important thing for people to realize is COVID ain't gone. It is here, and it is here to stay. And as with, again, I've been around a long time, and I've been practicing medicine a long time, and I've seen lots of new diseases that we were hoping we could get rid of and cure, and they'd go away, but they don't. And they just become one more thing that we need to be aware of as community members, but also as clinicians, as public health practitioners, and then try to teach people how best to avoid them if possible. Now, the good news with COVID is that it seems to be a little less severe. Part of that is it's been around, and so many of us have seen it, either gotten it or been minimally exposed, so we may have some antibodies, some protection as it's shifting genetically. So the virus itself is constantly playing a game with us, and it sort of puts on a new coat. And so it can outdistance in part the vaccines. We are in fact morphing, changing those vaccines so that they target the most prevalent variant of COVID that's around. But COVID has now taken its place along with influenza, RSV, and a host of other things that we get concerned about both in public health and medical practice, in trying to prevent, especially in people that are older or debilitated or in the very young. So it's not just the very old that die of a lot of diseases, it's often the very young as well. And so, I would, as a member of the public, consider either getting a vaccine if you've never gotten one. Been lots of folks that got it before you, and pretty much it's a pretty safe thing to do. Getting immunized is an act of loving kindness and caring to everyone around you and everyone you love. It's not just for you. So if your initial thing is I'm a guy, or I'm tough, or I don't care if I get sick, you have to also think about those around you, because when you get that vaccine, you're protecting others as well.
I think that the conversations that we have started to have during COVID, I think that they're still here. I don't think that they've completely just went away. I think that the conversation has transitioned though. So it went from this medical model of getting everyone vaccinated, we're in a pandemic, to now this notion around public health and equity, and how equity needs to be at the center of programming and needs to be really embedded in that conversation. And I'm really grateful for that part of it. I think that through that and through bringing it into an essential part of public health, that there's room for the conversation to continue.